Hello and welcome to Group 6's presentation on coronary artery disease, CAD.
Coronary artery disease is the most common type of heart disease in the United States. It can be referred to as coronary heart disease or ischemic heart disease. Coronary artery disease is a cardiovascular disease. Cardiovascular diseases can be defined as a type of disease that affects the blood vessels or heart in our body. Globally speaking, cardiovascular diseases are the leading cause of death, and over 75% of cardiovascular deaths occur in lower and middle class countries. The general issue in coronary artery disease is when arteries struggle to supply the heart with enough blood, oxygen, and nutrients due to cholesterol deposits or plaque buildup. Cholesterol deposits are substances that your body needs to build cells and make vitamins or hormones. But, like anything in this world, having too much of it can cause these types of health problems. Cholesterol comes from two main sources: our food and our liver. Foods that are high in saturated and trans fats cause our liver to create more cholesterol than it should. The additional cholesterol production is what takes the body from a normal state of being to an unhealthy one. There are two types of cholesterol, LDL and HDL. Having an imbalance of either or will in turn increase the risk of cholesterol slowly building up in the inner walls of arteries, causing them to become narrow, blocking the flow of blood, oxygen, and nutrients. As you can see here from this first picture, it is an artery and there's blood passing through it, although the yellow stuff is what seems to be plaque buildup and cholesterol buildup. That picture next to it is just a picture of the heart highlighted so we know what region is being affected in coronary artery disease. Moving forward, we realize that there is a direct correlation with the circulatory system and coronary artery disease. The circulatory system is a system that circulates blood and oxygen around the body. The heart is a muscular pump about the size of our fist that is located on the left center of the chest, as seen on the first picture. Blood and blood vessels make up the cardiovascular system. The heart is divided into four chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. These chambers include oxygen-rich and oxygen-poor blood, preventing them from mixing. The heart also has four valves that open and close during each heartbeat to let blood flow in and out. On the picture on the right, you will see that the circulatory system begins with oxygen-poor blood, which is shown in the picture as blue. This quote-unquote blue blood fills the right atrium and then flows into the right ventricle, where it is then pumped to the lungs through pulmonary arteries. The lungs create a new supply of blood from the air that we breathe. The now oxygen-rich blood will flow from the left atrium to the left ventricle. The blood is then pumped through the aorta to supply the body and its tissues with oxygen. Oxygen-rich blood is delivered by coronary arteries that extend over the surface of the heart, and each artery is a three-layer muscular and elastic tube lined with smooth muscle. Furthermore, we want to talk about the correlation with blood cells and coronary artery disease. Now, blood cells or otherwise known as erythrocytes, are cells composed of blood. In humans, the red blood cells are small, round, and appear to be concave a bit. Blood cells are flexible, and because they are so small, they can pass through extremely small blood vessels. The function of red blood cells and hemoglobin is to carry oxygen from the lungs to the body tissues where it is excreted. In the first picture, you will find a blood vessel and what a common blood vessel will have, such as red blood vessels themselves, a white blood cell, and plasma. Next to that, we show what a red blood cell contains, which contains primarily hemoglobin. And then inside these capillaries is where this oxygen is being delivered by the blood.
Now let's jump into the second part of the disease summary, history, starting with the historical background. One of the first accounts of CAD was by English physician Dr. William Heberden, pictured in this portrait here. Heberden coined the term angina pectoris, from Greek enkonhi, which means strangling, and Latin pectoris, meaning chest. This term is still used in this modern era of medicine. Heberden brought angina pectoris to the attention of the medical community through his paper titled Some Account of a Disorder of the Breast at the Royal College of Physicians in London in 1768, of which an excerpt is pictured here. In it, he described both typical exertional angina as well as variant angina, which affected a patient only when he or she was in bed and was relieved by sitting up. In addition, he also points out the influence of mental stress. Here is his most famous excerpt from the paper, of which many aspects are still true to this day. Heberden wrote, quote, "There is a disorder of the breast, marked with strong and peculiar symptoms, considerable for the danger belonging to it. Those who are afflicted with it are seized, while they are walking, and more particularly when they walk soon after eating, with a painful and most disagreeable sensation in the breast. The moment they stand still, all of this uneasiness vanishes. After it is continued for some months, it will not cease so instantaneous upon standing still. Most whom I have seen, who are at least 20, were men, and almost all above 50 years old, and most of them with a short neck and inclining to be fat, but the natural tendency of this illness be to kill the patient suddenly, and sometimes there is with it a pain in the middle of the left arm. Those who are afflicted with it are seized while they are walking, and more particularly when they walk soon after eating, with a painful, most disagreeable sensation in the breast, which seems as if it would take their life away, if it were to increase or to continue." Next, the natural history. If left untreated, those with the disease may face the following other heart conditions, some of which are life-threatening. Cardiogenic shock, which is a life-threatening emergency where the heart suddenly can't pump enough blood to meet the body's needs. This can develop after severe injury to heart muscle function, including heart attack or dangerous arrhythmia, which is an irregular heart rhythm. Heart attack, which is a blockage of the flow of blood to the heart. This can also occur if a heart artery becomes completely blocked due to CAD. Here we have an infographic showcasing how a heart attack is a circulation issue in the heart, while an arrhythmia associated with cardiac arrest is an electrical heart issue. Heart failure. CAD can weaken the heart, and a heart attack can damage heart tissue. Both conditions can lead to heart failure, which is essentially a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. The picture shown demonstrates how over time heart failure slowly damages the heart muscle because it is overworked. And lastly, arrhythmia. CAD and heart attacks can disrupt the heart's electrical system, which can cause irregular heart rhythms and possibly cardiac arrest. Now we'll go on to the prevalence of the disease. CAD affects about 126 million individuals, 1,655 per 100,000, which is approximately 1.72% of the world's population. 9 million deaths were caused by CAD globally. Men are more commonly affected than women, and incidents typically started in those in their 40s and older. Here in the photo of the map of the world is the global distribution of CAD, with the colors indicating prevalence rates per 100,000 people in the population in 2017. Red color on the places of the map indicate that Europe's prevalence of the disease is much higher than the rest of the world. CAD is the most common kind of heart disease among both men and women in the United States. White men between the ages of 35 and 44 are about 6 times more likely to die of CAD than white women in that same age group. The pictures of the two graphs demonstrate the age distribution of CAD worldwide, based on prevalence for graph A, which refers to the proportion of people who have a condition at a particular time period, and incidence for graph B, referring to the proportion or rate of people who develop a condition during a particular time period. The graphs exhibit how those in their late 30s and older are the age group who is more affected by the disease. The risk of having or dying from heart disease varies by race. Black, Indigenous, and other people of color are at more risk for complications from heart disease than white Americans, but it's also important to mention that this includes a higher death rate partly due to the barriers to healthcare biopic groups face. Also, the global prevalence of CAD is rising. It is estimated that the current prevalence rate of 1,655 people per 100,000 of the population is expected to exceed 1,845 by 2030, while Eastern European countries are sustaining the highest prevalence overall. And lastly, for the disease summary section, the presentation of the disease. The average presentation of patients exhibit the following presentation of CAD, which are also listed with their pathologies in the included image. Angina, 50%. Acute myocardial infarction, heart failure, arrhythmia, 20%. Fatigue, and sudden death.
There are several causes of coronary artery disease. It is neither a bacterial or viral disease, but it is the most common type of heart disease in the United States. The primary cause of coronary artery disease is damage to the inner layer of the coronary artery. Damage to this artery may be inflicted by a number of factors, including high cholesterol, atherosclerosis, high blood pressure, diabetes, and even smoking. People who have low-density lipoproteins, hypertension, diabetes, are obese, or have an immediate family member who has been diagnosed with coronary artery disease are more likely to have this disease later in life. This disease is the most prevalent in people ages 60 to 80, and only 1/5 as present in age groups 40 to 60. Because coronary artery disease develops over time, some people may not even notice that they have this disease at all. Having any one of the prevalent causes of coronary artery disease increases the risk of buildup of plaque in the heart. At the site of an injury along the coronary artery, fatty deposits begin to build up, forming a layer of plaque in the artery. The coronary artery is already an extremely narrow blood vessel in the body, and as plaque builds up, it gets harder and harder for blood and oxygen to flow through. Over time, this will present itself as mundane symptoms, such as shortness of breath and rapid heartbeats. Having coronary artery disease can lead to having end-stage congestive heart failure, which is life-threatening if left to be untreated. The coronary arteries supply essential nutrients, oxygen, and most importantly, blood to the heart. The buildup of plaque, as stated before, obstructs blood flow to the heart and can result in the complete blockage in the coronary arteries, leading to a heart attack. This is a problem because the heart receives its own supply of blood from the coronary arteries. The two major coronary arteries branch off from the aorta and supply the muscles of the heart with blood. The left main coronary artery supplies blood to the left side of the heart muscle, and the right coronary artery supplies blood to the right atrium and right ventricle. Heart attacks occur when blood flow to the heart stops, which causes the heart muscle to die. The heart is one of the most important organs in the body because it sends and receives oxygenated and deoxygenated blood throughout the entire body. If the heart muscle begins to die, all other portions of the body, especially the brain, will lack oxygenated blood and consequently lead to death.
Phenotype. From the strength of the blood vessels to the way cells in the heart interact, genes affect every aspect of the cardiovascular system. A single genetic difference or a mutation can influence the risk of getting heart disease. A genetic variation, for example, can alter the way specific protein functions, causing the body to metabolize cholesterol differently and increasing the risk of artery blockage. In the DNA of the eggs and sperm, genetic differences are handed down from parents to children. During development, a child's genetic code is copied into every cell of his or her body. Many cardiovascular diseases are facilitated by strong inheritance. For example, large-scale genetic studies identify hundreds of genomic loci that affect the risk of coronary artery disease. Blood pressure and coronary artery disease have been linked to DNA sequence variations in the GCUY1A3 and the NOS3 loci. Furthermore, loss of function mutations in the GUCYA1A3 associated with the risk of myocardial infarction in a large family enriched by premature coronary artery disease. Direct connection to heart function. Like all other tissue in the body, the heart muscle needs oxygen-rich blood to function, and oxygen-depleted blood must be carried away. The coronary arteries run along the outside of the heart and have small branches that supply blood to the heart muscle. The two main coronary arteries are the left main and the right coronary arteries. The left main coronary artery is the most important artery in the body. Blood is supplied to the left side of the heart muscle by the left major coronary artery. The branches of the left major coronary artery are as follows. The left anterior descending artery is the branch of the left coronary artery that provides blood to the heart's front side. The
The circumflex artery is a branch of the left coronary artery that runs from the heart muscle. This artery delivers blood to the heart's lateral and back sides. The right coronary artery supplies the right ventricle, right atrium, and the sinoatrial, and the atrioventricular nodes, which controls heart rhythm. The right posterior descending artery and the acute marginal artery are two minor branches of the right coronary artery. Since coronary arteries deliver blood to the heart muscle, any coronary artery disorder or disease can reduce the flow of oxygen and nutrients to the heart, which may lead to a heart attack and possibly death. Atherosclerosis is an inflammation and buildup of plaque in the inner lining of an artery, causing it to narrow and become blocked. What is the disease causing it to not work properly, and how would this work normally? The heart receives its own supply of blood from the coronary arteries. Two major coronary arteries branch off from the aorta near the point where the aorta and the left ventricle meet. These arteries and their branches supply all parts of the heart muscle with blood. High blood cholesterol levels can cause hardening of the arteries at a younger age. For many people, high cholesterol levels are due to a diet that is too high in saturated fats and trans fats. Once the inner wall of an artery is damaged, fatty deposits called plaque made up of cholesterol and cellular waste products tend to collect at the site of injury. This process is called arteriosclerosis. If the plaque surface breaks or ruptures, blood cells called platelets clump together at the site to repair the artery. This clump can block the artery. Sometimes a plaque can rupture and form a clot that blocks the blood flow. The interrupted blood flow can cause a damage or destroy part of the heart muscle and cause a heart attack.
So one of the first symptoms people tend to notice with CAD would be angina, which is chest pain that occurs in the middle or the left side and is triggered by emotional or physical stress, and it's going to feel like someone is standing on your chest. And then the photo on the right shows shortness of breath that usually occurs when heart doesn't pump enough blood to meet bodily needs. And in the photo on the left, it mentions like during a heart attack, and I will go more into detail about that on the last slide of symptoms. One of the other few symptoms are sweating, weakness, and nausea or dizziness, which is what's shown in this slide. And then the last one would be rapid heartbeat or palpitations, like heart palpitations. And that would be very similar to the heart attack, which I'm about to go into on the next slide. So the photo on the right just shows the symptoms and overview of what I just went over. So the dizziness, fatigue, shortness of breath, discomfort in the chest, and the chest pain. And then the reason why I incorporated the heart attack, which is a myocardial infarction, in this slide is because I found that sometimes you don't know if you have coronary artery disease unless you have a heart attack. So coronary artery disease can be symptoms of a myocardial infarction. So basically the coronary arteries are blocked, as previously mentioned, and those symptoms are very similar and include chest and pain in the shoulder or arms. Sometimes you have shortness of breath, sweating, indigestion, heartburn, cold sweats, and anxiety. And manifestations of this would be angina, myocardial infarction, heart failure, arrhythmias, and sudden death. So I incorporated that because even though they're two different things, they are very similar, and sometimes, like I said, you can't know you have CAD unless you experience a heart attack. So going into the treatments, the main one would be lifestyle changes. So that would include no smoking, managing your health problems that include, but they're not limited to, high blood pressure, high cholesterol, diabetes, have a heart-healthy diet, which is shown on the top photo, limit alcohol use, and the biggest one is to increase activity levels. By doing so, one can reduce the risk of a heart attack by walking 30 minutes 5 times a week or even 10,000 steps a day. So being active in a life is one of the lifestyle changes that is very important. For this slide, another one would be medication. So lowering your cholesterol, you would either take niacin, which is shown on the left. You could also take fibrates, statins, bile acid, sequestrants. To lower your blood pressure, you could take beta blockers, which is shown on the top, or you could take calcium channel blockers or ACE inhibitors. And then there's also medications to stop angina, which include nitrates, nitroglycerin, and ranolazine. And then the last medication would be to reduce blood clots. So anticoagulants, aspirin, and antiplatelets could also help. I thought this one was cool. So it's a non-surgical way. The method is called a balloon angioplasty, and involved with stenting if needed. So it's basically done with a catheter, which is inserted into an artery in the wrist at the top or through the leg with a small incision. And then the balloon is then widened. Then that would widen the diameter of the artery and restore blood flow to the heart. And then the stent would keep the artery wide open. So that is what's shown. The photo on the left kind of has more of a visual view of what it would look like. So that would be the catheter. And then the top photo shows the balloon angioplasty. So what would happen once that is widened. And then the bottom photo just shows the stent with the angioplasty if that helps keep the artery open. This is actually one I've never heard of before. Also very interesting. A coronary artery bypass graft, so CABG surgery. And it's basically creating a new path for blood flow when there's blockage. And then it will involve a removal of the vessels from the chest, arms, or leg, and then oxygen would be delivered to the heart. So that is what is shown in these two photos of how that process is broken down. And this would be one of the last treatments that you can get, which is EECP, which stands for Enhanced External Contour Pulsation. And basically they use inflatable cuffs to squeeze the blood vessels in the lower body, and it helps improve blood flow and creates collateral circulation around the blocked arteries. So on the left photo, it shows the cuffs being squeezed on the leg, and then the photo on the right just shows like how the blood circulates and moves up towards the leg. And EECP is only for those who have a chronic stable angina and cannot have invasive procedures or bypass surgeries, or no medication relief. So this is basically like the worst case scenario, like if there's nothing else that can help improve life with CAD, this is one of the last resort treatments that you would need. So the prognosis of CAD is actually treatable, but there's no actual cure for it, which means that one's going to have it for the rest of their life. And as I mentioned earlier, modifying your lifestyle would be the greatest way to do so going forward. There's also been an advance in medicine and surgery that have drastically helped the patients, and it also decreases mortality rates with CAD and cardiac disorders in general. So the factors like no smoking, diet restrictions, exercise, and stress management will make it possible to live an almost normal life. And the lifestyle changes along with medication are key to ensure a better quality of life and rate of survival. The photo on the top shows a heart-healthy diet, as people call it, and that would include like nutrient-rich foods along with meat and whole grains, because you're not supposed to eat whatever you want. Like you have to have a certain diet in order to stabilize your body. And then the medications is the photo shown below. And then the photo on the right is my main key point, exercising. So aerobic activities like cycling, swimming, and walking are highly recommended for people with CAD. And then last but not least, rehab programs can also be effective. That could help decrease body weight, depression, hospitalization, cholesterol, and angina if it continues to worsen over time. And yeah, that is the prognosis of coronary artery disease, and I hope you enjoyed our presentation. Thank you for watching.
Thank you so much for watching our presentation on coronary artery disease, or CAD. Here are our references.